Have you ever noticed that modern medicine has a massive timing problem? I mean, for decades, we've basically treated healthcare as a reactive system. We literally wait for a catastrophic biological event to happen before we swoop in to intervene. But if we're talking about true longevity and healthy aging, it's not about rescuing your body from the brink of disaster. It's about actively architecting your health span, years, even decades in advance. Welcome to This Explainer. Today we're doing a deep dive into the precision preventive guidelines that are completely redefining how we age. Let's get into it. So let's kick things off with a really crucial, somewhat controversial question. Does preventative care actually save money? Well, a super common misconception is that every single preventive action we take automatically slashes systemic healthcare costs. But the reality? When you look at the longitudinal data, it's far more nuanced. While some interventions absolutely reduce total spending by preventing massive, acute medical emergencies, others are better understood simply as phenomenal value. They drastically improve your daily quality of life and your survival rates, even if they don't lower the total bill at the end of the day. So we really need to reframe how we think about prevention. Think of it not as this magic cost eraser, but rather as a value-based, compounding investment in your own biology. It's just like compounding interest in finance, right? By making precise micro-interventions early, like identifying tiny metabolic shifts before they cascade into full-blown disease, you yield massively better health outcomes per dollar spent over your lifetime. You're essentially putting up roadblocks to prevent massive physiological disruptions down the line. To help you build this longevity shield, we're going to follow a clear roadmap today. First, we'll look at the power of prevention, then dive into metabolic and heart health, break down cancer screening timelines, unpack the fierce breast cancer debate, map out adult immunization schedules, and finally, look at bridging the implementation gap. All right, moving right into Section 1, the power of prevention. We need to clarify a vital distinction between two very common medical appointments that get mixed up all the time. An annual wellness visit, especially if we're talking about Medicare, is actually not a traditional physical. There's literally no physical exam involved. Instead, think of it as a high-level strategic planning session. It's where your doctor reviews your history, checks your cognitive baselines, and maps out a surveillance schedule for the future. The annual physical, on the other hand, is that comprehensive, hands-on diagnostic exam with lab work and all the vital checks. Understanding this difference is absolutely key to knowing exactly what to ask for so you can secure an accurate baseline for your health. Let's transition over to Section 2, metabolic and heart health. When it comes to metabolic health, the crucial pivot point you need to remember is the number 35. The U.S. Preventive Services Task Force, the USPSTF, has officially lowered the screening age for prediabetes to 35 for asymptomatic adults who are carrying excess weight. Now, why the change? Well, longitudinal data is showing an alarming spike in early-onset metabolic dysfunction. By intervening right at 35, we can use targeted behavioral protocols to entirely halt that dangerous progression into type 2 diabetes. It is a massive window of opportunity. And protecting your cardiovascular system, it's not based on gut feelings or guesswork anymore. It relies on a highly precise clinical algorithm. Here's how it works. If you're between 40 and 75, just a single risk factor like dyslipidemia, hypertension, or a history of smoking triggers a 10-year risk calculation. If your AHA prevent score hits 10% or higher, the data unequivocally supports initiating a statin. It's basically a calculated, evidence-based shield for your heart. Okay, moving to Section 3, cancer screening timelines. What we have here is your universal cancer screening timeline. These are the non-negotiable milestones for average-risk adults. The hard data dictates that colorectal surveillance now needs to begin at age 45. Cervical cancer screening initiates at 21, and breast cancer screening universally begins at age 40. Now, these age cutoffs aren't random. They are meticulously calculated by experts to balance the obvious survival benefits of early detection against the very real psychological and physiological harms of overdiagnosis. But here is the brilliant part. Within these timelines, optionality is what actually drives compliance. Yes, a colonoscopy every 10 years is the absolute gold standard for colorectal cancer, but you know what they say in medicine? The best diagnostic test is simply the one that gets done. If direct visualization is a barrier for you, there are highly sensitive at-home stool-based tests, like the FIT DNA test, that provide a vital evidence-based alternative. The ultimate goal here is systemic compliance, regardless of which modality you actually use. Let's dive into Section 4 and unpack one of the most hotly contested topics in medicine, the breast cancer debate. Recently, the medical consensus on this has shifted dramatically. The USPSTF, now decisively recommends universal biennial mammograms starting right at age 40. For a long time, women in their 40s were told to make individualized personal decisions with their doctors. But now, to combat rising incidence rates, the calendar rules. You turn 40, you get a mammogram every 2 years. Boom. But, and this is a massive but, the landmark Wisdom trial really challenged this strict calendar-based approach. It pitted that universal screening, which treats every woman the same based purely on age, against something called precision risk-based screening. This precision approach hypothesizes that we could actually safely de-escalate care, meaning we could skip mammograms for women who are mathematically proven to be low risk based on their genetics, while intensely monitoring those who are at a high risk. It's a totally personalized approach. And the results from that trial were absolutely stunning. 0. That is the exact number of advanced stage 2B cancers found in the trial's highest risk group. Think about that. By utilizing intense, alternating surveillance, we're talking MRIs and mammograms every 6 months, precision targeting successfully intercepted the disease in the most vulnerable patients. It definitively saves lives. Yet the trial also exposed a profound behavioral paradox. Despite the amazing targeted results, it totally failed to reduce unnecessary biopsies in the low-risk group. Why? Because of human psychology and ingrained clinical habits. Even when armed with hard genetic data proving they were low risk, patients and their physicians frequently just ordered the mammograms anyway out of sheer anxiety. It really goes to show that technological and scientific advancement is so often bottlenecked by our own human psychology. Old habits die hard. Let's shift gears to Section 5, Adult Immunization Schedules. Think of this as your invisible armor. Staying compliant with this continuously updated matrix of vaccines prevents massive physiological disruptions across the board. It requires annual updates for respiratory viruses like COVID-19 and influenza, those decennial Tdap boosters every 10 years, and crucially, initiating the 2-dose zoster series to protect against shingles once you hit age 50. If you look at vaccinations as age-based milestones, you can seamlessly anticipate exactly what your immune system needs as it naturally ages. At 19, you establish your baseline. Hit 50, and you initiate the shingle series. At 65, the game changes entirely. Your immune system needs more help, so you shift to high-dose flu vaccines and add pneumococcal protection. And by the time you reach 75, universal RSV administration becomes a key structural part of your longevity shield. Finally, let's look at Section 6, Bridging the Implementation Gap. Because here is the hard truth. All this incredible science of longevity is totally meaningless if it stays trapped in textbooks or elite clinics. The Community Preventative Services Task Force strongly advocates for something called patient navigation to bridge this exact gap. You can't just instruct a historically disadvantaged population to magically navigate a highly complex healthcare system. You have to deploy accessible screening tools, like those at-home stool tests we talked about, directly into community ecosystems, like local health fairs. You have to meet people where they are. And we are seeing this work in the real world. Local health networks, like the Mariposa Community Health Center, are actively closing the health equity gap through these multi-pronged community hubs. By leveraging electronic health records to spot vulnerabilities and literally deploying community health workers directly to patients' homes, they are dismantling geographic and financial barriers. They are transforming preventative theory into actual, safe lives. It is a real game changer. Ultimately, the clinical guidelines we've explored today are so much more than just medical bureaucracy. As this quote perfectly captures, preventative care is more than a healthcare strategy. It is a life philosophy. By embracing value-based compounding and truly understanding your biological timelines, you are actively architecting your own physical resilience. You are literally building a high-quality future for yourself. So, we have mapped out the science of health span, and the tools for precision prevention are sitting right in front of you. The only question that remains is this: are you going to just let your biological age dictate your future by default? Or are you ready to take control, schedule that baseline wellness visit, and purposefully architect the decades ahead? Thank you so much for joining me on this explainer. The science is clear, but the rest, well, the rest is up to you.